Here on 90.3 FM, it's Wednesday. That means it's time for Joe Steckler and Helping Seniors of Brevard. Good afternoon, Joe.
Good afternoon, John. And I'd like to thank all of you that are listening on this rainy day, but you're probably very smart to be inside your house or in your car. But if you're in your car driving, pay particular attention to these roads. You know, a lot of people don't realize that when we... down here in Florida, it gets so hot sometimes, and some of the roads that we have is with the excess of asphalt they put in the mix, that when it rains, the roads can become very, very slippery. And one of the reasons I know that is in my younger youth, I worked 2 years on a blacktop crew, and I never will forget those times because that's some of the hardest work I ever did in my life for 75 cents an hour. I hate to think what they make now, John. They make a lot more than that now. But
what was that, the work program or something like that?
No, I started out working for a plumber my junior year in high school, and I got 50 cents an hour. And I did such good work, I guess, the other plumber in town hired me the next summer at 75 cents. And then when I worked for the blacktop crew, I got $1 an hour. I'm sorry.
Well, I'm sure that was probably pretty good money, right?
It was good money in those days. They enabled me to save up enough that summer for my first year in college.
Wow, but incredible!
It was a fantastic.
Some good memories.
It was. I was a walk-on for the basketball team, and I hate to think of me trying to run down a basketball court today.
Were you good?
No, I was just an average player, just average. But I think they needed some cannon fodder for the varsity because we scrimmaged the varsity all the time, and we had two of the small college All-Americans on Murray's team, a guard and a center. In those days, a center at 6'5" was very, very tall, and it's not that today. And the guard was a little All-American. He was 5'10", and he ended up being the tennis coach here for 50 years, I guess
Wow.
It was.
Are you still a big basketball fan?
I love to watch Kentucky. Yeah, I like to watch Kentucky play. I watch some of the other schools, but Kentucky continually comes up with a good team.
Yeah, they sure do.
Yeah, they always have. Yeah. We got Lee on the phone there?
I'm here, Joe.
Yeah, do you enjoy hearing me talk about Kentucky basketball?
Was Kentucky Rick Pitino at one time?
You're gonna have to, I'm gonna get to John to bring you in a little bit louder for me.
Hey,
but,
John.
How
loud can we get?
Yeah, I can hear you better now.
Good.
But
Kentucky, was Rick Pitino the coach there at one time?
I'm sorry, talk a little slower there.
Was Rick Pitino the coach of Kentucky?
Rupp was the coach when I was, Adolph Rupp, and that's why they named the big arena after him, Rupp Arena.
Oh, you're talking about a long time ago. Okay.
Oh, yeah. But that arena will hold 25,000, and it's full for every Kentucky home game. No matter who they're playing, there's always 25,000 people watching there. But, we talk about basketball, talk about my wife and I were driving down here today to the show. Some of the things that we talk about in the past and think about the future, I guess, you and I talk a little bit about, I'm really way ahead of, and let me go back. For all of you that are just listening to the show for the first time today, this is Joe Steckler, and I'm the host for Helping Seniors. And Helping Seniors is it's an information program. It's an education program. And we help seniors get information and help them become more informed about some of the services that are available in Brevard County, and for that matter, statewide and nationally. I'm becoming more warily as I get older, and at 85 I can still learn, but I'm very fortunate. I've been through some pretty severe medical problems, and I'm able to still I still get around, and the brain seems to continue to function. I'm just delighted about that because I was associated with the Alzheimer's work so long, and I saw so many heartbreaking things, and I realized that the good Lord has been very kind to me, and it's enabled me to be associated with people like you, Lee, who, while you are a professional as a dentist, you're always also a professional at, I'm going to use the word solving problems. I know that this is really, really off the show today, but because what we're going to talk about, folks, is people getting their teeth pulled when they don't need to get them pulled. And it's something that people need to know more about because it's a subject we don't talk about. But there's another thing that our professional people do that we don't get talked about is that if it wasn't for a lot of our professional people, folks, I wouldn't be sitting here doing this radio show. It's people like Dr. Sheldon and other professionals that contribute to nonprofit organizations and that try to help people. And I'd just like for you, Dr. Sheldon, I didn't even hit you with this question. I didn't even put it to you when we talked about what we were going to talk about on the show this morning. But I know that you have a very unusual charitable program that perhaps you might just describe it to people so that people know that there's more to a dentist than going there and getting a tooth pulled or somebody to get down in there with picks and everything down in below your gums and pull all that decay out so that you don't have periodontal disease.
Well, the first thing I wanted to do, Joe, is to wish you a happy birthday.
Happy birthday?
Happy birthday. You celebrated your 85th birthday last month.
Wait, what did you say?
Didn't you celebrate? Didn't you become 85 last month?
Oh, yeah, it was last month, yeah.
Well, this is the first time you and I have been together since that time, so happy birthday.
Well, thank you. It was actually in December. It was December.
It was in December? Okay.
Yeah, it was December. I remember that. I remember it. I don't remember my mother having me, but I remember my 85th birthday, Lee.
That's good.
But, if the people are listening to the show and they wonder about a guy like me talking to a guy that's a dentist, and those that have listened to us over the years know that we will talk about the topic that we're going to talk about, but we'll also get off on side topics that a lot of those side topics often help people. And, I think, Lee, about all the people that are our sponsors, and I've asked you several times because, if a person has a pain in their chest and it runs down their arm or something like that or in their jaw, they head for the hospital or they call 911. They're thinking about a heart attack, right?
Yep.
How about all those people that sit in their house on a weekend or at night that they're eating something and they feel a chunk of tooth break off, and if it breaks off and you don't have pain, you're very, very lucky. But if it breaks off and you have pain, you are in a real situation because, if somebody asked me where you'd go if you had a severe tooth problem, well, I know what I'd do. I have your phone numbers and I have your email address, so I could call you.
Yep.
But there are a set of 600,000 people that live in Brevard County. How many people do you think are that fortunate that have access to somebody that while you're a periodontist, you do implants and everything else, you could still do all kinds of dentistry?
Correct.
So, and if somebody's in pain, you could help them.
Right.
But if a person has a dental problem, if they're in pain, what would you as a dentist say to a listener, Lee? What would they do if they had a problem?
All right, well, let me give you the honest truth as much as I can give you the honest truth.
That's what I want.
Okay. So if a patient is a regular patient of mine, I'm seeing them for examinations and reviewing them periodically in order to prevent what could occur on a weekend from occurring on a weekend. In other words, if I'm doing my job, doing correct diagnosis and correct treatment planning, the number of people who are my regular patients who will have an emergency is very, very small. So the first thing that I would say is if you expect to get a service on a weekend, I provide service on a weekend, but I provide it for my regular patients because I've had the opportunity to work with them and get things under control for them. But if a patient doesn't have a regular dentist, or says he or she is going to see the dentist only when things are bothering him, then frankly, you don't have access to me. I won't see you. And that sounds pretty callous, I know, but I'm not in the business of emergency dentistry. I'm in the business of keeping you healthy. So if I fail to keep you healthy, or if something breaks and you're a patient of mine, you're darn well I'm going to see you on a Saturday. I'm going to see you on a Sunday. But if you're not a regular, and by the way, most dentists will do that. But if you're not a regular patient, then essentially you're going to go to the hospital, get pain medication until you can get into the emergency dental clinic, which then we have a few in Brevard County, or until you can see a dentist or an oral surgeon on that Monday when you get back.
Okay. Are you saying that, and this is something that I know that you and I have talked about it a little bit, but if a person, and there are a lot of people that don't go to a dentist, you and I know that,
yep.
and they have a dental problem, it's still pain whether they have a dentist or not.
Correct.
And if they have a dental problem like that, can they go to an emergency room at the hospital?
They can. In fact, usually they will, and the emergency room in the hospital, they'll be prescribed pain medication or antibiotics if there's an infection, and be told to see a dentist when they can get into a dentist the following week.
So if a person, that's pretty good advice. And I never even really thought about it because I'm sure a lot of people that would hesitate to go to an emergency room because urgent care clinics could probably take care of that same thing, couldn't they?
Correct.
So there are a lot of, I guess what we're getting at is if people are better informed about all the medical treatments that we have available, that they can do a better job of taking care of their own, dental or medical health. But that's no substitute for going to a doctor, going to a dentist, and having a dental treatment plan, correct?
That's correct, yes.
So, you wrote the article for the paper about are too many teeth being extracted.
Yeah.
What?
I think it's a big problem. I think it's a tremendous problem.
Why is that, Lee?
Well, let me give you an example of a patient that I saw when I wrote the article. It had really bugged me at that point. So the patient had been seeing a dentist, and the patient had periodontal disease, and the periodontal disease was deteriorating, and so on a particular tooth. And so the dentist said, without consulting with the periodontist, the dentist said, well, listen, this periodontal pocket is getting worse and worse. It's just going to continue to get worse. I think before it gets so bad, I think we better extract the tooth. And so the dentist and the patient had the tooth extracted. Had the patient come to see a periodontist, so I asked the patient, I said, was the tooth bothering you? No. Was there an infection? No. Well, periodontal disease is an infection. Was the tooth loose? No. And the answer is, had that patient been referred to a periodontist, the patient would have saved the tooth, because the periodontist would know how to treat the periodontal disease. The biggest difficulty I have is that there's an assumption out there that because somebody has periodontal disease, that it can't be treated. And the assumption also is that the patient doesn't need to be referred to a periodontist. And as a result, this patient had the tooth extracted, and now if we need to replace the tooth, we need to do a major bone graft in order to be able to put a dental implant in. Or we have to grind down two perfectly healthy teeth in order to put in a bridge when there's a strong likelihood that the tooth could have been saved. So that's one example. Second example, we look at the TV commercials. TV commercials that talk about extracting teeth, putting implants in, and putting teeth in all in one day. And you see the poor patient describing that she had gone through multiple this and that, meaning treatments, and finally gave up and called this organization which extracted the teeth and put implants in and put teeth in on the same day, which of course we do in our office too. The difference is, in many cases, those people had not been referred to specialists who could have looked at the patient and perhaps could have saved the patient's teeth. I don't know that. I don't know the history of this patient, but I do know this. The same patients that go to those places that are advertised on TV, those same types of patients come to see us. And for some of them, we have to do exactly what they say, extract all the teeth and put the implants in. But some of them, we can help them and we can save their teeth, and they don't have to go through all that time and unnecessary surgery. And so the problem that I have here is that there are assumptions being made when specialists are not consulted, and the patient makes a decision to do something that may be necessary but may not be necessary because the patient had never seen a specialist to look at the problem to determine whether specialty care could have helped that patient.
Well, when I read your article, of course, I read every one you send and we publish, but I like the comparison that you made between doing treatments for knees and for let's see, it was a knee and
knees and hips.
Knees and hips.
Yeah.
Yeah, I can understand because right now I've been going through what they call a collagen treatment in my knees, where they're trying to they take the fluid out of my knees and then they inject this stuff in there with the needles hanging in my knee, and it's 5 treatments at each leg, and I've done the left, and it does feel better, but rainy days like today don't help at all.
Sure.
But I can see what you're saying when you made that comparison about people trying their best to save a joint and go in for major surgery instead of going in for major surgery. And we don't make that comparison a lot of times to taking care of our mouth.
Yeah, it's true, particularly on our younger patients. When we see our younger patients, and our younger patients have let their teeth go in whatever way they have, to extract the teeth and put in dental implants with the assumption that that's going to be a lifetime cure is not necessarily the correct assumption to make. You know, dental implants have their problems too. You know, we probably do more dental implants, or as many dental implants as anybody in the county. So, and we have been doing it for well over 30 years. Dental implants aren't perfect either. And the same diseases, particularly periodontal disease that can affect teeth, can affect dental implants. It's much easier to control periodontal disease on a tooth than it is to control peri-implant disease on an implant. And so, again, we're going on assumptions. Well, this tooth has periodontal disease. Let's get it out before you lose so much bone that we can't put a dental implant in. That's usually a false assumption.
Well, you know,
and what we'd like to do is to maintain that tooth for as long as possible, and so then later on in your life, when you need a dental implant, fine, we can put the dental implant in. And in other words, we're nurturing the bone and we're nurturing the teeth and keeping things going, and looking at it from a lifetime perspective rather than a now perspective that there's only one treatment can be done. I think dental implants are great, but I think they're oversold and they're overprescribed, and people are assuming the dental implants are perfect when in fact there's no false anything that's perfect. Everything has its upsides and its downsides.
I agree. And, you know, probably one of the questions I bet a lot of our listeners have is that, you know, you keep talking about dental implants in one day. Every time when I've had surgery or had something done, we've always waited a day or a waiting period before to let the gum adjust, or doesn't the gum need to have time to heal before they put those implants in? When they keep talking about all this same-day implant surgery?
Well, we do same-day implant surgery a lot. As a matter of fact, we found that same-day implant surgery is as successful as delayed implant surgery, as long as you choose your case carefully. So, yeah, it can be done. Yeah, the old days were extract the tooth, wait 2 or 3 months, then put the implant in, wait 4 to 6 months, and then finally put the tooth on the implant. These days, more often than not, we'll extract the tooth and we'll put the implant in at the same time. Now, the reason for that is that we've got a number of different biological mimicking factors that we can put in around the implant to help that implant heal and heal in faster, so the patient only has to go through one surgery rather than 2.
Well, it's kind of, I don't know, for lack of a better word, I'm going to say weird, because here you are, a guy that's made his name. At least it's I go under the assumption you made your name because you had that big sign out there that said solid bite dental implants, and you have done so many leading edge technology type things with dental implants that no other dentist in the county is doing. And I know that for a fact because I've read some of the work you've done and some of the stuff you've published yourself. But I know that you've gone to seminars all over the United States and outside the United States to see what some of the leading edge technology is. And I was talking to somebody recently, and they were saying they just couldn't do anything about their dentures because they didn't have any bone left to attach the dentures to. And I said, no, you're not right. I said, go to a dentist that specializes in this type of work. And I said, I know for a fact because when they put the implants in my mouth, they had to take some stuff out of my, I forget exactly, you can explain it to the listening audience because I don't remember exactly what you talked about, but you grew bone in my jaw so that I had enough bone structure there to support. And I know we're getting close on to the mid-show break, but can you blow a hole in that theory, Lee? Because can people that can't afford dental implants, can they grow bone that will enable them to have successful dentures?
Not very readily, Joe. You can do it for a short period of time, but the denture itself will put so much pressure on the gum tissue and the bone that bone will go away. Okay, that's what I see. That's what we assume, Lee, that when we start reading this stuff in the paper or go online on the internet, that there are these certain things. We assume that they should be able to use it for almost any type of surgery or any kind of medical procedure you want to do, and that's not always possible. It isn't. I can give some qualifications to that after the break. When do you have to take a break? Okay. Listen, Lee, we're going to take a mid-show break. Okay. We'll come back and stay with us, okay?
And let's welcome back Joe and his special guest, Dr. Lee Sheldon. Joe?
Thank you, John. It's really always a pleasure to have Dr. Sheldon on my show. Today, John didn't say it, but we're broadcasting on WEJF. It's a new signal for us, and it's just what I hope will be the start of a major new network series for helping seniors, and where we'll have a chance to get more information out to people to help people. For those of you who are listening today, I ask you to tell other people about the show because this is how we build a good network of listeners. It's our listeners that enjoy and are like what they hear, and they're going to tell other people about it. And I know that I have got people that I've been getting calls. I've been answering the phone, folks, since late November. I've taken almost all the calls that come in to helping seniors, and I can assure you that some of the callers I get, they're heartbreaking. I just wish that there were some way that we could help everybody. It's just not possible. But I can tell you that if you don't identify your problem, if you don't try to get help, you're not going to get it. And the phone number, if you have a question for Dr. Sheldon or me, if you just want to pitch in something about dental care, dental insurance, whatever you want to talk about, our phone number here is 720-888-5800. 722-9998. 722-9998. I encourage you to call. This last week, I had two elderly ladies. And I say elderly, they're older than I am. But they called for help. And I asked them how they heard about helping seniors. And they said they've been listening to this radio show for years. They read our columns, our articles in Hometown News. And they read about us in Senior Scene magazine. And it's Dr. Sheldon, you have an article almost every month in Senior Scene magazine. And I probably hit you with something, I don't know how good your memory is, but what are some of the types of topics that you like to write about that you want people to be better informed about dental care?
Well, I think this is one of the topics right now. One of my main, and this has changed, as you know, because Joe, you and I have been together for what, 20 years?
Yeah.
Yeah, something like that. And the topics change as they become more relevant. And I think the thing that I concentrate on right now is the lack of referral to specialists when specialists could help you. It is a big issue because there are assumptions made that because a general dentist can do a procedure, that in fact he or she is the expert on the procedure. And while that could be the case, the specialist is more likely to be an expert in the procedure. That's number one. And number two, the specialist may be more likely to say this is not a good idea rather than it is a good idea. I we just saw a patient just before you and I got on the air. And a patient came in because he had a tooth extracted, and the question is, should we do a dental implant, or can we do an implant? And the answer was, yes, we can do an implant, but I'm not sure it's necessary for you. And so I asked the patient a few questions to determine whether it was necessary, because it wasn't medically necessary, it was an elective type of procedure. So if I can let the patient know that, in fact, you can make the decision on your own, you're not going to be harmed by not doing the dental implant. Have I done the patient a service? Yeah. Have I saved the patient some money? Yes. And the patient then has an opportunity of saying yes or no, this is a good idea. Another example of this is the patient that you referred to. And I'm going to change your scenario a little bit, because before the break you asked me, is there any way you can put in a bone graft in order to be able to help support dental implants? And the answer is not likely. There are some things we can attempt, but the likelihood of it helping is very small. But I receive, and I can't tell you the number of patients that come into me who were told by somebody else that they couldn't have a dental implant when in fact they wanted one. And the first question a patient should ask, and the first question that anybody who's considering a dental implant should ask is, have you had a dental CT scan taken? Because unless you have a dental CT scan taken, you have no idea whether there is sufficient bone or not. And most of the patients who come into our office who are told they don't have sufficient bone, in fact, do have sufficient bone, or with a minimal surgical modification can have sufficient bone to have a dental implant placed.
Let me ask a question then, Lee. How fair would the question be if I said to you, Dr. Sheldon, is a dental implant always the answer? And think about that for just a minute and associate that with dental tooth decay. If a tooth is not doing well, and how can you tell if a tooth has decay or if it's breaking, or what contributes to the factors that lead to pulling a tooth, to putting an implant in? How do you determine that as a periodontist?
Yeah, it's a good question. I think there are a few things I have to look at. Number one is how much tooth structure has the decay destroyed? Because the more tooth structure the decay has destroyed, the weaker the tooth is, and the better the opportunity for that tooth to fail or break as a result of putting a crown on the tooth. So the first thing is how much of the patient's natural tooth is left. The second thing, assuming there is enough natural tooth left, it's can we, with a root canal and with some gum surgery procedures, restore the tooth and make sure that tooth is going to last for at least 10 or 20 years? And there are certain things that we can do through diagnosis to determine that. The third thing that I look at is the patient overall prone to decay? In other words, am I seeing cavities all over the mouth? Because if I see cavities all over the mouth, I know that patient is prone to decay, eats a lot of sugar, has dry mouth due to medications, has a lot of acid in the mouth, and therefore I'm less likely to recommend saving teeth in that particular circumstance. So there's a certain thought process that kind of a mental checklist, if you will, that I'm looking at in order to be able to determine for a patient whether it's in his or her best interest to save teeth or not. I can tell you this. A periodontally diseased tooth is much more predictable to keep than a tooth or a patient who has a lot of tooth decay. Tooth decay, I'm more likely to recommend dental implants than I am in the circumstance of periodontal disease, which we can treat.
Say that last again now, so that people understand what you just said.
If a person is very prone to decay, I'm more likely to recommend extracting. If the patient is prone to periodontal disease, and I feel we can treat it, and most cases of periodontal disease we can treat, I'm more likely to recommend keeping the teeth.
So what you're saying is that as a periodontist, you strongly believe in trying to save a tooth through the use of periodontal disease treatments as opposed to a person that is just prone to decay for any number of reasons, and you find widespread decay, then you're more likely to have to pull the teeth.
That's right. And with periodontal treatment, it isn't just periodontal treatment because I have plenty of people who come into my office saying I had periodontal treatment done. I think the first thing is periodontal diagnosis.
Okay, now, here's something that I'm sure you've thought about it. Maybe you haven't. But you're a dentist, and you're accustomed to having... I know in your practice, you almost got people waiting at a door to get in to see. I know that. On the other hand, how about as we have progressed with medical and dental treatments in the United States over the last 20, 25 years, and a lot of the people that are in their 80s, early 90s now, we're not made aware of the types of treatments that you and I are talking about today. So, first of all, we have a lot of these people in the category that they simply can't afford to go to a dentist. Yep. And they're in trouble.
Yep.
And that's a problem. We've got to overcome that. And one of the things that I see in being an advocate for the elderly, I would like to see a better program and better information disseminated to people in the education of dental treatments as well as medical treatments, because we can save money and we can save a lot of disease treatment if there was better information about dental care.
Well, I got to tell you, there are a few things that are happening in that regard, and I've got several answers to that. So let's go to the newest answer that we have. There are some health insurance companies out there who are seeing that if patients are seen for periodontal treatment or for frequent cleanings, they're less likely to need heart disease treatment, and therefore those patients are spending, if you look at them actuarially, if you look at them statistically, the patients who get their diseases under control, therefore their dental diseases under control, you don't need to spend as much money, and it all comes down to money, in the hospital to take care of heart attacks and take care of heart disease. And so some of the medical insurance companies are seeing that and are starting to pay benefits for medical treatment, for dental disease, which is kind of neat. Now, it's not widespread, but the statistics are already there saying if you get your dental health under control, you're less likely to have heart disease, which is kind of neat. And the insurance company only compares, well, maybe not only, but primarily is concerned with how much money they have to pay out in benefits. So if they have to pay out less money for heart disease because somebody has dental cleanings done, the medical insurance company is all over that, saying we'll save money, and they're doing it. So that's it from that perspective. I've got another answer, but am I kind of clear on that part of it?
I think what you're saying is that insurance companies are becoming more cognizant of the fact that if they make more dental insurance available, it will help lower the cost of other medical insurances.
That's right.
Have you had dental type insurance companies come to you to make proposals to you to take that kind of insurance?
Not yet.
I'm sorry, say it again?
Not yet.
Not yet?
But given the fact that the data is already there, I expect that that's going to occur.
But you think it's going to happen?
Yep, I do.
Then, if that happens, if a dental insurance program was a fair program that made it possible for dentists to accept dental insurance and expect reasonable treatment, they could still be practice dental care the way it has been practiced and not become a dental mill.
Oh, I would think so. I mean, part of it being a dental mill is the individual practitioner himself. I mean, we all choose as dentists and physicians too, choose the type of practice they want to have. And you know the type of practice we have, and I'll only practice the way that I want to practice. If somebody says I want compromised dentistry, I'm not the place for you to go. I just won't do it. So that's part of it. But when it comes right down to benefits, here's what I see. I see that you won't even need a dental insurance policy. If you have periodontal disease, you'll be referred to a periodontist, and the medical insurance will pay for it according to medical insurance benefits, because the medical insurance carrier is less likely to have to spend money on heart disease, which is considerably more expensive with doctors and hospitals and everything else that's involved with that. I don't think it's going to go the dental insurance route. At least I hope it doesn't. I hope it goes the medical insurance route.
So what you're saying is you think that there's going to be dental insurance offered through the medical route instead of the dental route?
For periodontal treatment only.
For periodontal treatment only?
Right. Because that's the only, at least as far as I know, that's the only relationship they're seeing in reducing hospitalizations, reducing hospital costs. It's for periodontal treatment.
Yeah, I know, because if I go to a dentist to have a dental treatment done, I don't even it's just a cleaning, I have to take antibiotics because I had a heart problem.
Right.
And as much as they don't want to admit it, people need to be aware of the fact that I'm just amazed that there are so many people that have heart procedures done that don't understand some of the things they should or should not do.
Well, I think I can't answer that very well. I can tell you that when we're training in residency and we're in a hospital environment where physicians and dentists are working together, there is, if you're going to have cancer treatment, you need to get screening by a dentist first. If you've got heart disease treatment, it's got to be screened by a dentist or a periodontist first to make sure that end of it is under control, because they know it's going to make a difference, or it's likely to make a difference in the success of the medical problem.
Well, you and I have done these shows over the years, and both TV and radio, and we have seen the effects of not having a good dental program, not taking care of your mouth, we talk more about the relationship of disease that can travel from the mouth into the heart and to other organs of the body. And like I think you said earlier in the broadcast we were talking about today, that the medical insurance companies are becoming more and more aware of this, and the fact that if they do a better job of getting patients the type of care that they need, and while they may have to pay something for the insurance part of it, it's going to lower their overall cost for medical care.
Correct.
So it just seems like a no-brainer, but to still go back to the problem, Lee, of people of my age, my generation, that were not aware, or they did not become informed of all these things. I can tell you, I just yesterday I had a phone call, and I neglected, or I just couldn't get back to the person in time, and it took a couple of days. I got back to the person, and I said, "Did you get your problem taken care of?" And she said, "Yes, we got the wheelchairs and the equipment from somebody." And I said, "That's good." I said, "I apologize to him because I didn't get back." But then I started asking some questions. I said, "How old is your mother?" She said, "She's 88. I said, "Was she married to a World War II or a Korean veteran?" She said, "Oh, yes." And they said they were divorced 20-some years ago. I said, "Did she ever remarry?" And the woman said, "No." I said, "What's her income?" And she said, $1,400 a month. I said, "Do you know she's eligible for Veterans Aid and Attendance?" She didn't know that. She didn't know that her mother was eligible for other veterans' benefits because of her husband's service. And it's just it bothers me, because I know that if I know that you have teaching seminars. You still do that, correct?
Yeah, we've got one coming up next Thursday night at 6.
Where's
Thursday night, February 21st, right next to my office.
In your office? How many
right, the building right next to our office. Just call our office, 259-8000, 259-8000. If you'd like to come in. We've already got 28 people who are coming to this event, and our promotion hasn't even gone out yet. So I don't know what we're going to do, but we'll find a way of. We actually looks like we're going to have 2 lectures going on simultaneously now in order to be able to accommodate the amount of interest that we have.
Well, we out at one senior place. Have you ever done a seminar out at one senior place?
Never. Nope. I did. I was in their library for a while, but never did a seminar there.
Okay. But let's say we have elder law attorneys that go out there and they give seminars. We have other home care outfits that go out there and give seminars, and people come in there and listen. But they're not the low-income people that go out and listen to these seminars. They're the medium or high-income people that do this. One of the reasons that so many people can't afford long-term care for medical benefits. Hell, some of them can't even afford the Part C for the Medicare. And I encounter people all the time, Lee, that simply have Medicare. They have the Part A, but let's see. They don't have the supplemental insurance, so they're covered 80% of their procedures, and are terrified to go to the hospital or do anything because of the copay or the 20% cost. And yeah, for big operations and everything, it could be a real problem. But to me, if you want to have a successful life, you need to do a better job of taking care of yourself. Yes. You might incur a medical or dental expense, but it's much better to incur that expense and be around longer to help be with your family.
Yeah, I mean, part of this obviously is an income issue, and part of it is a failure to plan issue. And you and I have talked about financial planning before. I think on one of the TV shows we did that years ago. But if we're talking strictly from a cost standpoint, still the cheapest thing that you can do is get a denture. And that's still available, and that's most people can afford that. We have some good discount dental clinics who do dentures at a very, very affordable rate, and at least will give you the opportunity of being free of disease and have something that looks half decent, and maybe you'll be able to do a little bit better too.
A lot of it depends on how much you're willing to part with the financial assets that you have on this earth. And, you know, more people should think about the fact, Lee, I think, that you can't take it with you, and you might as well try to have a healthy mouth, a healthy body, and spend some of the darn money that we try to pass on to children, and think about our own comfort. And you know, you could. A lot of people don't realize this, and it's something that you and I've never talked about on a radio or TV show. But have you ever seen anything about the effects, the cause and effect relationship of maintaining good dental health throughout your life as opposed to life longevity?
Oh, the studies are already there. Unfortunately, when you don't maintain good dental health, sometimes you're lacking in other things as well. You know, you and I have talked about nutrition. We've talked about other exercise. We've talked about a number of ways in which you can take care of yourself. You know, the person who lets himself go, you know, and the person who takes care of himself, but neglects one part of it, if we just get that part normalized, that person can do a lot better and can live a lot longer, and not just live a lot longer, but live more comfortably and have good quality of life. That's well documented.
One last quote. We're just about out of time, but what would you tell a patient about getting a second opinion?
Do it. You know, among specialists, we have differences. I was referred to by a specialist today, and he wanted my opinion, and we gave the opinion, and we got that. Go to a specialist, find a specialist, and get a full examination done.
I agree with you 100%. It's always a pleasure to have you on the show, Lee. And the one thing, are you finished with your third book yet or not?
Right now we're staying with what we've got.
Oh, you're going to stick with The Ultimate Mouth 2?
No, that was actually The Ultimate Mouth Manual 3, and I don't have any plans for number 4 right now. Number 3 just came out a year ago. Right now we're sitting tight with that one.
Okay.
Okay.
All right. Thank you, Lee, and thank you for being on the show today and helping our listeners get a better appreciation of the value of good dental health.
Always a pleasure, Joe.
Thank you, Lee. Thank you. And thank you, listeners, for listening to us. And be sure to tell others about helping seniors and our radio show, because we depend on you to be our network. I'll see you next week. Bye-bye.